On International Overdose Awareness Day, we want to remind you that we can all do something to save lives.
The lives of the people we love, the lives of our peers.
It is essential to ensure the distribution of naloxone. We need to know how to recognize an overdose and how to intervene. Both health professionals and peers must be prepared.
Drug checking is an important tool to protect health and prevent overdoses. We should actively support its implementation.
Peer action and advocacy are crucial. We want to promote awareness. Together we can save lives.
Hello, my dear friends. I am Sergio Rodrigues, drug user activist from Porto, Portugal. I wanted to advocate for all the government should give free Narcan or naloxone to drug users and friends and their families. Only this way we can stop the death from overdose. Thank you. Big hugs from Porto with love.
I'm Daphne Chronopoulou from Peernaps, Greece, and I am the Euro Input Chair. I started using heroin when I was very young, in my teens. And some years ago, it dawned on me that most, if not all, of my fellow junkies of that period are not alive anymore. It was a very hard time. I remember we were very young, we were using, and whenever someone used a bit more, we used to say to our friends, please, if I die, throw me in the streets and disappear, or leave me in my house and don't think of me again. Otherwise, we would be arrested as murderers or conspirators. I'm very glad to say that those times have passed. It's not perfect now, but we have some tools. We have harm reduction, we have naloxone, which should be in every house of everybody who uses heroin or opioids. And we know what to do so that our friends, our family, ourselves do not die. Drugs should be a pleasure. We should be able to enjoy our lives without guilt and take drugs and explore and have fun without paying with our lives.
Hi, my name is Lino and I'm from Porto and I am 33 years old and I am a drug user for 35 years. In 2020, I did a training at harm reduction, and they teach how to use the naloxone, how to know the sickness of the overdose. It's very important to give the naloxone to the peers, for they act on that situation to reverse overdose and stay hydrated.
No praise for naloxone, no praise for our lives. A free and widespread distribution of naloxone is necessary as a life-saving drug for the treatment of opioid overdoses. Narcan save lives.
Using a safe drug is the only way to use drugs. Drug checking stations provide the opportunity to choose and prevent risky use. Use drug with awareness.
There are many ways to test drugs. We no longer want to do it with our lives. Change direction is possible. Let's use our heads. Let's use drug checking.
Don't be afraid to pick me. Stick the needle wherever you want and save my life. You don't have to be a doctor. Distribution of naloxone can save our lives and our loved ones. We want it available now.
Our naloxone project started in 2016. The main cause was huge influx of migrants. They couldn't get OST treatment. That's why they used drugs. A lot of them overdosed. That's why we begin to implement this outreach project. During COVID time, we had to have a really harsh government, right-wing oriented, Nazis in fact. We have a syndicate of taxi drivers from Yugoslav Republic, and they provided us with the transport during the curfew. Between 9 in the evening to 5 o'clock in the morning, and you couldn't go out from your flat. There were huge fines and problems, but taxi drivers could. So we organized 2 workshops and about how to help with naloxone, and that's what it. We don't get naloxone in Slovenia. We need to get it from friendly organizations from Italy, from Germany, wherever we can. Naloxone is treated in Slovenia as strictly for medical use. That's why this naloxone intervention even more important. That's it.
Es importante que la naloxona se pueda dar, o sea, que esté legalizada, esté controlada, tengamos recursos para poder tirar adelante, que se pueda enseñar a la gente a cómo usarla, a que recursos como Energy Control, que testean drogas, que lo sigan haciendo. Y bueno, ¿qué podemos hacer nosotros? Si políticamente nos pueden echar una mano, que sería lo más importante, ahí es donde podemos engancharlo todo, ¿vale? Vamos, socialmente, o sea, a nivel social y político, si pudiéramos tener ese apoyo, sería mucho más fácil para que nosotros pudiéramos desarrollar un mejor trabajo del que estamos haciendo ahora mismo. Muchas gracias, un beso.
Naloxone saves lives. For International Overdose Awareness Day, I just want to stress the importance of access to naloxone, the importance of peer-to-peer distribution, and the importance of drug checking for safer consumption and to save lives. We are facing a toxic supply crisis similar to the one in North America. Access to naloxone is only one of the steps that we need to take to ensure a better quality of life for people who use drugs. Peer-to-peer distribution of naloxone is especially important because peers have access to drug-using spaces that aren't accessed by traditional outreach teams. A lot of people in over-policed communities would experience a lot of stigma for carrying this, and it would label them as a drug user. We know most people will use drugs in their lifetime. When you criminalize something, you innately give it stigma. In order to break down that stigma, if we take the prescription away, we normalize it. We tell people that it is just normal to save a life. It's normal to use drugs. Providing free, safe access to naloxone tells drug users that their lives are worth something.
Hi, my name is Christos, coming from Athens, Greece. For over 45 years now, there's a very powerful tool who is saving human lives and reversing opioids overdose. This is naloxone. It's not just a tool, it's an act of love. It's an act of protecting human life, especially if you work in a community setting, the people around you are in high risk. The drug users, the users, they are in abstinence and things like that. You have to carry naloxone, or you have to ask your agency to provide you. You can save a life. But why this powerful tool is reversed only for a few? The medicine doesn't discriminate. It's ready to save anyone, anywhere, anytime. When you carry naloxone, you transform the fear into action. You can save a life, one life at a time. Thank you very much.
Almost 20 years ago, I survived an opioid overdose after having left a rehab. Nobody told me or my peer about what naloxone is and how it works. Unfortunately, this ignorance is still widespread today. On this International Overdose Awareness Day, I want to say, give naloxone to people living rehabs, prisons and other closed settings. It is not about enabling drug use, it is about harm reduction and saving lives. Together, we can beat this ignorance.
Dear comrades, it is a pleasure to finalize the campaign of the International Overdose Awareness Day of this year, 2024. It has been amazing to see
the participation of our colleagues, mates, friends, advocating for naloxone use. We all know that only if the community gets this tool, we can avoid deaths and avoid grief of our comrades. Every life is so sacred and joyful if we have actually access to tools that allow us to live, allow us to have the pleasure we want to have, and allow us to guide our freedom in our psychotropic careers. And this is a life note to the galaxy to say and to finally state that, as we all know, naloxone saves lives. So yeah, thank you for your collaboration.